Yeah, so I thought it was quite interesting, but now we're going into some specialist area.
Thank you very much, Ricky. Thank you. Hello, everyone. My name again is Yasir, or you can put Yas, Y-A-S. So I'm a psychiatrist. I work with emotions all the time. You know, we are sometimes commented on by our medical colleagues that we don't work that hard, but actually working with emotions. Working with emotions is so difficult. It is so draining. So I thought, you know, that I need to talk about this in our scenario. When we were discussing the scenario, we talked a lot about conscious factors in supervision and where or why supervision relationship can go wrong. But actually, we haven't touched this unconscious level, the subconscious level of why two people will not get along. So I thought about talking about this transference and counter-transference. It's not a specialist area. I would disagree with Ricky. It's a very common thing. At this minute in time, while you are listening to me, there is a transference reaction from you towards me. Perhaps I am reminding you of, I don't know, a psychiatrist you came across before, whether negative or a positive experience, but just the tone of my voice, just my posture, just is, you know, eliciting some reaction from you, and as well, you know, a reaction from me towards you. This is the counter-transference. And, you know, when I researched a little bit about the definition, of course, these two terms were coined by Freud, but Freud actually didn't write too much about them. You know, these are one of the things that he described, and his followers over the years just keep writing about and theorizing about. And it's basically, in its basic form, means any emotion from a person, whether a client, a patient, a colleague, will develop towards another person, and this emotion will be influenced by the previous experience of that person. So they will project, you know, hate or anger or resentment from previous relationship or love towards that other person. And the other person will invariably, you know, will have some emotions in return for that person. So that's the counter-transference. I can give you so many examples about that. I mean, you think that's maybe just in psychology and psychiatry, but actually, you know, in medicine, when you have a patient who always comes back to you with self-harm, what usually will happen sometimes is that people, medical, you know, professionals will develop some resentment. Oh, she done it again. Oh, she has self-harm again. So this reaction of counter-transference to her is so strong, and her reactions towards you will be what when you send her home all the time? Her transference to you would be, is it love? No, that you just don't listen. You're just like the others. You think I'm faking it. You think I'm attracting attention. So as I said, this comes in nearly every situation, even in our personal life. But let's focus about the supervision, okay? So what are the signs of transference in a supervision? We just saw the slide from James. I like that, you know, from Scrubs. What was the, you know, the junior doctor doing to Dr. Cox? He was hugging him. When he was hugging him, what he was saying?
It's not like a pharmaceutical.
Exactly, that's a strong transference reaction. So, you know, we see it in action every day. And these are some of the examples of transference in supervision. And I discovered that there is a lot about that, you know, a lot of literature about that, mainly from psychology. So supervising psychologists to, you know, to psychologists who are performing therapy for patients. So this is a mandatory that a psychologist, when they give treatment to patients, they need to get a supervisor that they go to and discuss their emotion about the patient with their supervisor. So there is a whole lot of literature about that. So, you know, these are a few examples. The trainee idolizes the supervisor. Have you heard one of your colleagues saying, you know, this is the best consultant I've ever worked with. You know, there is nobody like him. Or on the contrary, this is the worst person, he's horrible. And you say, well, I worked with that consultant, he's not that bad. So that could be a sign of transference reaction, that they have very strong emotions towards that supervisor. Or, you know, the trainee's need for acceptance or approval from the supervisor all the time. You know, you go to, you know, this trainee and you say, can you make a decision on that? Oh no, I have to go back to my consultant. I'm sorry, I cannot do that. And they will go back and discuss every minor decision with the consultant before doing it. And why is that? Why is this specific reaction is happening? Why is the trainee so looking for, you know, pleasing the supervisor? What could happen in their early life, in their childhood? So maybe they never felt good enough. You know, maybe their parents always, you know, criticized them and made them do this, basically. So always trying to please their parents, always trying to be good, so that their parents will kind of, you know, be happy with them. So they are repeating the same pattern with the supervisor, and that's not good. This is one of the things that may impair the relationship. Sexual or romantic attraction. You would imagine that this is really not common, but actually it is very common. And when you read the literature from psychology, many supervisors, many psychologists will report sexual feelings towards their clients. Again, you know, studies about, you know, PhD students mainly, again, you know, point out to, you know, to these things. So it seems a common thing. You know, which is, again, what I would like to say is that these all are common feelings. The important thing is to recognize them. Again, transference examples. The supervisor's role in the trainee's life. I think this is very important. Sometimes in medicine and midwifery and nursing, we are so busy, we don't have a social life. So the supervisor is the only person that we meet regularly. And this will lead to a development of strong reaction. Again, you know, trainees with mental health problems, people with personality disorders, for example, or bipolar disorder, will have ups and downs, and during these ups and downs may behave in a disinhibited way. So that's, again, you know, a danger that we need to be very aware of when we are supervising people with mental health problems. Self-confidence of the trainee. Some trainees do not have self-confidence, so they will always get back to the supervisor to get a boost, and they would like to get some approval. Again, when you are supervising those trainees, what you need to do is just to build this confidence up gradually, so that they will be more confident. And the image of the supervisor. Again, as a supervisor, if you felt that your trainee is idealizing you, just work on that. Just say, well, you know, I've done this and that, I've done this mistake, and discuss learning things from the things you have done, so that the image become more realistic. Because what happens is that if they have a very idealistic image about you, they will be so disappointed if you do a mistake. Counter-transference examples. Have you ever felt that before supervision? I did. It's very common. And again, the important thing, what I'm saying is that it's fine, you know, don't be ashamed to feel like this before supervision. But just realizing it and talking about it and reflecting on it will help the situation, will help the relationship to get better. Unexplained anger or rage. Missed supervision meetings at the last minute, you know, you send an apology. Ending supervision meetings too early because, you know, you are so busy, you have an operation, you have something else. So all these are signs of counter-transference. And this is the importance of peer supervision and peer group discussion. Because when you are a supervisor and go back to your group and you say, well, I didn't do supervision for my training for 3 weeks now because I was so busy. So maybe they can work on that. Examples of counter-transference. So The trainee may remind the supervisor of someone they have strong feelings to, negative or positive. Coming back to the scenario by Arshad and James, perhaps Arshad is reminded, by some incompetent doctors he worked with before, and he feels that James is just like them. And this is why he is developing this strong strong reaction to James. So, when we talk about what would be helpful for Arshad, I don't think it's just going to a course. I think it's reflecting on the emotions he has about James. So, tell us what James is reminding you of, why you are so rude to him, for example. Are you rude with everyone or just specifically with this person? Over-identification. So when you are a supervisor, maybe the training will remind you of yourself when you were young, when you done some mistakes, so you will be, very compassionate with them. Or, on the other hand, maybe this over-identification will not help, because they will remind you of a period when you were very inexperienced, very, very naive, and you don't like that. You don't like these memories to come back to you again. Parental feelings towards the training. Have you ever felt that? Are you kind of responsible for your training? Try to give them personal advice? Again, it's a very common thing. Don't be ashamed of. The important thing of recognizing that perhaps I'm being too paternalistic with my training. Perhaps I can give him more space, to make mistakes. It's fine. Sexual or romantic attraction, again, as we said, is very common. Now, this is a very interesting thing. Ricky just mentioned an example of a Hungarian supervisor. Yes, cultures do vary. And when two people from two different cultures will sit in supervision every hour, weekly, for a year or so, it becomes a contributory to why the relationship may be very good or very bad. Have you seen this? I'm not sure it's very clear. Have you seen this photo before? So this is Kate Middleton, awarding an athlete in the Olympic Games with a medal, and he refused to shake hands with her. He just done this. Okay, so that was a bit of an awkward moment, and if you Googled it, and it was reported in various media. How dare this athlete just refuse to shake the hand for Kate Middleton? But people coming from a conservative Muslim background from Iran, they don't shake the hands of women. This is forbidden in their culture. So imagine if you are supervising this, a doctor from that culture, and you are shaking hands with them and giving them a hug every time you see them. That's so awkward for them. That's so uncomfortable for them. So again, be wary. Be aware about these differences and try to think. Am I developing is part of this dysfunctional relationship because they are coming from a different culture? So considering these issues is important. Now, what could happen as a result of these reactions if they went unnoticed, if nobody discussed them? All sorts of bad things will happen. Crossing boundaries, anger, overprotective or apathetic attitude, not acknowledging or working with the counter-transference, reinforcing trainees and own relationship patterns. So when they feel that you're always treating them as a failure, they will fail. And then your idea about, for example, junior doctors, that they are incompetent, will be reinforced. And damaging the supervisory alliance. And we talk in psychology about psychotherapy alliance, but actually there is this term, supervisory alliance, where the two people are working to achieve a common aim. How to overcome the reactions, as I said, discussing it, being aware about it. You will never eliminate it, but just discussing it and how it's affecting your relationship will be good. So perhaps one idea you can take today is that perhaps you can bring this to your workplace. Suggest that all the supervisors in your workplace should meet 1 hour once a month in a group and discuss their ongoing supervision for trainees and how to improve that. Again, being aware about your emotions and accepting these emotions. Don't fight them, they will always be there, but work with them and be consistent with boundaries. These are just few recommendations. Again, training of supervisor is essential prior to supervision, but again, not in training courses, in group discussions. Please do that in your work. Discuss these things with your colleagues. Written contract for supervision. Have multiple people involved in the evaluation, so there is no strong transference reaction towards one person, so there are different people. Train supervisors, again, and avoid supervisors who are professionally apathetic, because they wouldn't engage in any discussions. Counter-transference, transference requires deep reflection, and if they are not interested, they won't achieve that. So that's it from me. Thank you.